Hey guys, it's Dr. Daniel Segai, board certified dermatologist in the Seattle area. Thank you for subscribing to the channel. Been here for 4 years and having a good time. Summer's over, but let's talk about how to manage hair loss. It's one of the most commonly brought up issues in dermatology clinic because we deal with everything skin, hair, and nails. A lot of people don't know that, but we do deal with hair loss. And it's one of the hardest things to treat. So let's go over hair loss myths and also proven treatments that could help with hair loss, okay? Because there's no magic bullet. Just want to start off the video by saying that everyone's different and there's different types of alopecia. Alopecia is a symptom and not a formal diagnosis because there's all types of alopecia, and I break them up between scarring and non-scarring alopecia. Well over 50% of the time, it's going to be non-scarring alopecia, whether it's autoimmune alopecia called alopecia areata, where you have non-scarring patches of hair loss in children and adults. A flare is usually triggered by stress, some big stressor, whether you are emotionally stressed out by events in your life, or if you have gotten sick, especially hospitalized, that can trigger some hair loss for sure. And you can get to the point where you lose your eyebrows and eyelashes and all the hair on your body. And that's called alopecia universalis. If it's affecting the whole scalp, that's alopecia totalis. So let's go over some myths just to start off the video. What do you guys think about that whole myth growing up that hair loss is inherited from the mother's side? Maternal side has to have the hair loss for you to have the hair loss gene. That is completely false. That myth has been debunked, and that hair loss gene that we are isolating it to can be passed down from your father's side as well, not just mother's. So I think hair loss is definitely multifactorial. There's definitely hormones, genetics, stress, diet, vitamin deficiencies are all playing a part in our hair loss processes. So I would say for the gene, from the genetic standpoint, whether it's androgenetic alopecia in males or female pattern alopecia in females, you can see that as early as 19 years of age. I'm seeing 20-year-olds who are losing quite a bit of hair, and you're seeing a lot of scalp. So it can happen very early on in life, and that gene can be inherited from both mom or dad's side. Next would be brushing hair helps with hair loss. There was some TikTok saying that if you brush your hair 100 strokes a day, you can increase your hair growth. Actually, the studies have shown if increase the brushing can actually increase hair loss. That makes sense, right? You're causing more trauma, you're mechanically pulling out hairs, and that will lead to more hair loss. You know, I compare it to like traction alopecia, where you get scarring or non-scarring alopecia at the front hairline. If you're wearing tight ponytails, tight braids, those can lead to trauma pulling hair out, and people have that receding hairline, and it could be permanent too. You know, like Ariana Grande or JoJo Siwa wearing those really tight ponytails, you can actually put a lot of strain on the hair follicles where you can permanently lose your hair. So brushing the hair, fine to do every once in a while, but be careful. Doing multiple strokes can cause more hair loss. Now, there is something called scalp massage, and scalp massage is actually shown in a few studies, small studies, that it could help with increasing blood flow to the scalp, to the hair follicles, bring it into the growth phase and increase hair growth. That is a possibility, but I want to see larger studies proving that. So scalp massage is different from hair brushing. Scalp massage may be actually beneficial for hair. Going down the list, there's rosemary oil. You've seen a lot of this on TikTok, and even olive oil. I'd say olive oil, do not do. Olive oil can actually worsen scalp itch, scalp dandruff, because the main player behind scalp dandruff and actually flares in your scalp psoriasis is this yeast called Malassezia. We pick it up as babies. It stays on our skin as a normal colonizer that just hangs out on our scalp, doesn't cause too much trouble until our immune system isn't cool with it. And our immune system might drop as we get older, or you might have other medical issues like, say, Parkinson's, HIV. You can have a lot of Malassezia activity up there. And you could also just be healthy and just have Malassezia sensitivity. And it can cause scalp itch, scalp flaking. And how do we grow it in the lab and culture Malassezia, the special yeast? Add olive oil to the media. And so I would say do not put olive oil onto your scalp for hair loss, because that will just be fertilizer or food for the Malassezia, and it'll proliferate, come down to your face, even come down to your body, and it won't be fun. So stay away from olive oil. But rosemary oil has been shown in maybe 1 or 2 studies to be equivalent to topical minoxidil 2%. So for me, I'm like, not a big win there. I'd say go for 5% minoxidil, whether you're a non-pregnant female or a male, and use that 1 to 2 times a day. So I'd say the rosemary oil is not very impressive, the data behind it, if it's just equivalent to 2% minoxidil. I'd say it might be good for those who can't tolerate topical minoxidil. If it's drying out your scalp, it's causing irritation in your scalp, which we definitely don't want. We want to stress out the hair follicles further. I'd say rosemary oil is probably best for those individuals. Also, if you're pregnant, you could talk to your OBGYN on the particular rosemary oil formulation if you want to work on hair loss while you're pregnant. So always run it by your OBGYN. After pregnancy, there's a thing called telogen effluvia where you get non-scarring alopecia, where you get 6 months of hair loss. And that happens after pregnancy. And you might want to consider rosemary oil while you're breastfeeding. And always run it by your doctor, of course, before doing any kind of over-the-counter formulation for your scalp, okay? So that's my thoughts on rosemary oil. Very, very mid, I'll say. So going down the list, topical minoxidil, of course, I want to talk about because it's been around for a while. Very much a good foundation or supplement to your treatments. And topically, you can find it, we said 2%, 2.5%, and even 5%. And sometimes it might be labeled as men's formulation, 5%. That is just totally bogus. If you're a female who's not pregnant, you can go for that men's strength minoxidil, okay? You can do that 1 to 2 times a day. And I feel like the biggest mistake people make is they stop minoxidil too soon. They give up way too soon. I tell all my patients 9 months of consistent use of minoxidil before you can see improvement. In the first 2 months, you might see increased hair shedding. So it can be a little frustrating, this process. But if you stay with it, you'll notice you'll have less shedding, more regrowth about month 6, and then you'll see its max potential at month 9. So stay with it. I prefer minoxidil foam over the solution. Solution has propylene glycol. It can be more irritating and can cause an irritant contact dermatitis more readily on the scalp. So go for the foam if you can. Costco makes the minoxidil 5% foam, and it's a great deal. And also I want to talk about oral minoxidil, which, what are my thoughts on that? It's gotten quite popular since a New York Times article came out about oral minoxidil. And I gotta say, it's actually a really good treatment orally. You just have to find the right patients who can tolerate a blood pressure medicine orally, because minoxidil, as you guys know, is a blood pressure medicine, and we give it in very small doses for hair loss. And a lot of my patients do tolerate it, but I just don't give it to patients who are, on other antihypertensives. If they're already on a blood pressure medicine, I don't want to add another agent to their mix and then potentially cause, low blood pressure and fainting and dizziness. So definitely got to screen out the right patients. Talk to your dermatologist to see if you're a good candidate. But I've even had females on higher doses, higher than I would expect or I would prescribe, but they actually would have increased hair growth on their neck and face. And that's the biggest side effect when you're taking minoxidil, and guys don't usually mind, is hypertrichosis from minoxidil causing hair growth everywhere. So a lot of my male patients don't mind or even notice, but female patients, I actually make it a very small dose to help prevent that from happening. And I've seen it happen. So when you see increased hair growth, even on the neck for females and on the face, you really start believing like, wow, this is actually doing something. The topical formulation could be doing something, but orally, yes, definitely helping with hair growth. And the whole point of using minoxidil is to increase blood flow to the scalp and making your hair follicles happier and more likely to be in the growth phase than the sleep phase or the transitional phase. Sleep phase being telogen, transitional phase being catagen. You want it in the anagen phase as much as possible, which is the growth phase. Next is Finasteride. Patients talk about this a lot. A lot of my male patients are on this medication, and it's a blocker of the enzyme that activates testosterone, makes it into dihydrotestosterone. And when you are messing with hormones, I always talk to my patients about sexual dysfunction, impotence, side effects, and there are rare cases where it could be permanent. So I always talk to my male patients about that possibility. But this is a great treatment for hair loss because what we understand is the testosterone, the androgens for males and females, actually is contributing to hair loss by causing miniaturization of the hair follicles. And so we're trying to prevent that from happening as much as possible. Keep that nice hairline for our male patients, and also the top of the scalp where we get thinning at the crown, and also just the whole top of the scalp starts to thin out over time, as well as our receding hairline. Whereas women get a wider part and decreased density of hair throughout. So very different patterns, but both affected by androgens. So Finasteride is a nice oral prescription medication we'll talk about in clinic. Topical formulations are out, and we do talk about that for our male patients and also female patients who are postmenopausal. Okay, so that might be a nice option to have like minoxidil compounded with finasteride. I have a few patients over age 60, say 65, who are doing very well on that. Next question I get would be laser caps. Are those effective? That actually isn't a myth. Laser caps are low level light therapy, LLLT. Those caps that you can buy for $1,000 or more on Amazon or Costco or other websites like Iris Store, Red Restore. Those are actually good technology. And if you were to compare them to topical minoxidil, it's actually on par. But there are some studies that show that if you do both, you increase efficacy and they synergistically work together. So I do recommend that to my patients who have the extra cash to pay for a cap that you would use every day to every other day for about 7 to 15 minutes, depending on the brand. And you would walk around with this cap, shining red light, feels a little warm. I've used it many times on my own scalp, and you're like washing dishes, reading a book. You'd leisurely do while having the cap on. It's usually a portable battery that you walk around with in your pocket, and you can get stuff done around the house while you're treating your scalp. So I'd say that the laser therapy caps, totally fine to add on with your regimen, whether it's oral prescription medications or topical medications. Okay, so that's my thoughts on LLLT technology. Lastly is Ketoconazol. Ketoconazol has been a shampoo or a cream that we prescribe in dermatology at 2%. The shampoo formulation is great. It's great for taking away that yeast called malassezia, and it's good for like tinea versicolor, where you got those white or brown patches, especially in humid weather. It's just a nice shampoo to have, but it also helps block androgens. That helps prevent miniaturization as well. So that's a nice little trick that I tell my patients. And I know a lot of hair experts just give their patients Ketoconazol right off the bat. If the patient's not pregnant, that's a huge thing. I don't want to give it to pregnant patients because, again, we're working on hormones, right? So Ketoconazol not only works on the yeast, but also could help with hormone-related hair loss. So over-the-counter wise, you see Nizoral shampoo, and that one is a great start. Or if you want to go to a dermatologist, we'll prescribe the 2% Ketoconazol. So those are my thoughts on hair loss myths and science-backed recommendations for those who are struggling with hair loss. The pandemic was a really tough time for people, and I saw a lot of hair loss related to stress, and that's telogen effluvium, similar to the process that happens after pregnancy. It's a big stressor to your body. You're going to lose hair afterwards for 6 to 9 months. And after COVID infections, we've been seeing people lose their hair. A lot of women have lost their hair and they're waiting for it to come back. And it can take 9 months for it to start going back to normal. And telogen effluvium, it's hair shedding, massive hair shedding, where you're just taking clumps of hair out. Whereas this genetic-based hair loss that we've been talking about, the treatments for those, that a lot of that's gradual and progressive. So we're trying to slow that down as much as possible and hold on to as much hair as we can, prevent the miniaturization of those follicles as much as possible. Okay. So I hope this video is helpful. Thank you guys for watching the channel. I appreciate you all. I hope you have a great start to fall. And I'll be in Amsterdam in September, and I'll be headed to New York for the US Open as well. So we're going to have a busy September. Please share this video with your friends who are into skincare or who are struggling with their hair loss. Hopefully this video is helpful. It's not medical advice, but just education on hair loss and ways you can attack hair loss. Okay. Please hit the like button. Please subscribe to the channel. And I'll be coming out with new videos still every Saturday morning, 9 a.m. Pacific Standard or 12 p.m. Eastern Standard. Take care, guys. Peace.